working.
The mic.
Hello. Can I call to the stage Thomas Eisenberg, Deirdre Ryan, Monica Encini, and Thomas Tuller.
Give an applause when they come on stage. That's very nice.
If I understand correctly, we have apologies from Jeroen Lehners MEP, who has been a supporter of SIP for a number of years now and is still a very active MEP on the Employment Committee in the European Parliament. I think we're going to start with Thomas Eisenberg. Thomas is the Executive Director of the German Pain Society and also a member of the Berlin Parliament, so a man with his hand in the political world as well. And Thomas is going to talk a little bit about the German Pain Society and their activities.
Yeah, thanks, Sam. I'm merely here in my function of Managing Director of the German Pain Society. And I would like to, to demonstrate some of our activities. And first of all, within the last 7 years, we changed our structure. The German Pain Society consists out of 3,500 individual members. Many of them are psychologists, many of them are nurses, many of them are physiotherapists. Of course, the largest groups are doctors, but I want to mention all these other groups because our mission is interdisciplinary work. And maybe this might something to answer your first question, what could be a mission for ZIP in the next 10 years as well. Maybe also to emphasize more than in the last couple of years, the interdisciplinary work of pain management, also in Europe and also reflecting in such workshops like today. Then we changed our bylaws in the society. We incorporated all these scientific medical associations that have a concern around pain. So we consist out of these umbrella organizations with roughly 100,000 members, plus patient organizations in the field of pain. And then we set up in the last couple of years a national health forum. We do not have a national ZIP platform, but we don't need this because the local chapter is the national ZIP platform by work anyway. So we put up the national health forum, which conducted several sessions in the last 6 years. Actually, we had 6 sessions. One was on chronic pain in the situation itself. Then what's the situation in nursing hospitals and nursing institutions for elderly people? How is the quality of pain delivery? How is the orientation in terms of patient orientation? What can be done for young children and for adolescents in the next couple of years? That's topic tomorrow with our National Pain Forum. And exactly because of this broad approach, we were quite successful in some achievements. For example, the National Parliament set up with the Health Ministry a disease management program in back pain, for back pain patients. It's described exactly how back pain patients should be treated, and there is a payment system set up for this, and this will be nationwide set into place starting next year. Plus, there is an institution called the Federal Joint Committee, which is the umbrella organization, an administrative structure of all hospitals, of all doctors, of all insurance companies. And the patient organizations, they have the right to debate their issues, and they have the right to put forward issues they would like to have, they would like to make proposals on. So the patient organizations consulted us and put forward a proposal to work on also acute pain indicators, quality indicators. And this is now being discussed in one of these really many subcommittees. It could turn out like the situation in Spain or in Netherlands. So maybe we will have later on an acute pain health qualitator in this area as well. Then the permanent conferences of the health secretaries, health ministries of the federal states and the federal government put up a resolution on pain. And we are now going to evaluate how this has been changed, the situation in the federal states. And we will discuss this next year with our federal governments ongoing. And then I would like to point out a third major achievement out of all these discussions. We have a law in Germany which obliges the health insurances to spend 300 million euro each year for health delivery, for service research, and for new programs within this area. And we were quite successful also as Pain Society, as German Pain Society. We got two big projects, one in the area of chronic pain, it's called Pain 2020, and one in the area of acute pain. For acute pain, we are now trying to identify patients with a higher risk for post-operative pain and to set up a transitional pain service out of this money, which then, if successful, could be scaled up all over Germany. With the other project, Pain 2020, we try to identify patients who are not in a too chronic situation for the intensive care treatment, but we try to put up two new pathways with education and lower intervention after a thorough assessment, interdisciplinary assessment, as a structural element for pain delivery in Germany. So this is something that we as the society operate together with more than 30 centers, and we are quite happy that this might be something we could ask other governments also to spend money with their organizations for delivery research. We also set up a map of all these scientific projects that exist, and this is a really big matrix here for our activities. I just wanted to point out one more thing. That's the Action Day Against Pain. Each June every year, we have one day where more than 300 hospitals open up, give lectures to patients, or where we have a telephone line open up with 100 experts participating, with a couple of thousand patients calling in. We make press conferences there as well. We really utter concern in the area of field. And if you ask what might be a future for ZIP, maybe you introduce a European-wide action day against pain also, where we all can cooperate at the same day to a certain issue. Thanks again to the ISP working group. We had several dates, appointments here with the German representative, German permanent office here in Brussels. And I'm very happy to see that Grünenthal, the ZIP platform, and DIMDI is quite active in this area as well. And I would like to emphasize one more idea in addition to putting up the ICD-11 process. And maybe we could also ask that the presidency talks about a pain core indicator. I'm not talking about a pain quality indicator. Quality is not a concern of the European level, except for talking about it and giving ideas to think about. But the core indicator is something which the WHO has set up, where you can see heart attacks, for example, or other diseases measured and can make a benchmark between the countries. And I think it might be a very successful thing if we achieved within the next couple of presidencies of the European Council also to make such a pain core indicator as an official tool within the European indicator framework. Thanks a lot.
Thank you, Thomas. Although Germany is not an official SIP chapter, I think there's a lot of activities that you've had in Germany that create a really great example for some of the activities that we're trying to push forward at national level in other EFIC chapters and in national SIP platforms. I'd like to call to the podium now Deirdre Ryan, who is the chair of Chronic Pain Ireland and is also a board member of Pain Alliance Europe. Thank you very much.
It's now good evening, isn't it? Almost. We've made it this far, so I'll just ask for a little attention. I had a slight scare a few minutes ago when we were asked, what do we want to see for SIP in the next 10 years? And I realized at that point I'd be living with chronic pain for 21 years. And I go, what will that life look like? But also my second thought then was, well, actually what we're doing here today can very much have an impact on what that life can look like. So will there be a pathway for patients that are newly diagnosed with chronic pain? Well, ICD-11 will already have been implemented, ICF, really enriching those diagnoses. So will that enable pathways so that somebody isn't waiting years and years, as I did, for a diagnosis in the first place, but then, like for cancer now, for example, there's a very clear pathway on who you should see. The patient doesn't even need to think. It's laid out for them, and they just follow the path in terms of how they can live with their condition and how it can be managed. So is that something that we're going to see? I think at European level, in a slightly less personal way of looking at things, I think big data really, how we all interpret this big data is really going to be a large part of how we operate as individual organizations and as SIP. So it's all this drive, so much so in the research and gathering big data and, you know, seeing the big picture, but also remembering how do we let that also trickle down? How do we bring that back to national level, at the national SIP level as well? Will the indicators for pain, will that have determined quality within our healthcare systems? Or was it more like a core measure as to the condition itself? What will that look like? And I know Joop, the president of Pain Alliance Europe, he very much sees indicators as, especially in the next few years, something that really can be developed. But work that we've been doing at the advocacy level and the lobbying level too, that, for example, with the Brain, Mind, Pain MEP interest group, even recently we've been speaking with the MEPs. We've many signatories at the moment. We had 2 of the 3 co-chairs at our first meeting. I think that was just yesterday. The days go by quickly here in Brussels. I think it was yesterday. And we had our first meeting. The theme in that case was access. We will be following up on stigma, obviously in different areas. And the MEPs need to be interested. They also have constituencies at the national level too. They want the patient engagement. They want to be able to include people in policy, and initiatives like SIP and the Brain, Mind, Pain Grant and MEP interest group really are a very direct example of how that can happen. We can see, to have the people here that wrote ICD-11, to have the infographics by SIP on ICD-11, on ICF, making those recommendations, it's showing how closely linked the goals are of so many different stakeholders. So I think keeping that at the heart of SIP and keeping open arms to everybody else that wants to get interested or become involved, because I think another move that could come along would be sort of a pan-ministry, inter-ministry, a multi-ministry approach to health, in that often the benefits of an efficient and effective health system are often measured in other ways, in terms of employment, in terms of justice, in social inclusion, the general GDP in terms of the exchequer of how much people can stay involved in work. So I think we're going to see more areas interested in pain that don't directly deal with pain because of the knock-on effect. And I think the data there is going to be really interesting, because with all the silos at the moment, everything is very individualized, yet there's huge potential for crossover there, that if we can improve things with health, that actually we can show the efficacy in other areas as well. So that's my brief vision. I also hope I'll be living well in 10 years' time, that I can talk to you all then, if I'm still around. And thank you for the opportunity to share a vision.
Thank you very much. Deirdre, just one question. Thank you for your vision and for your good wishes also. Thank you very much. And meanwhile, I said there's a second question, and you have time during this session. Just let me ask this question. It's pretty similar to the other one. What will be your personal priorities for the next 10 years as far as your involvement is concerned? So we have time enough to think about it, pass it around. Back to you, Sam.
Thank you once again, Deirdre. I think there's something that the patients can do in terms of setting out a vision for what the experience is like for them. What will life be like in 10 years for patients that others in the room really find a bit more challenging. I think it's great to hear your view on how things could look in the future. Next to the stage we have Monica Ensini. I won't give a full introduction because she spoke earlier today. We talked earlier about the strategic plan that you have, and I'd like to hear a bit more about the future of pain research in Europe.
Thank you. Pain-focused and pain-related research has been substantially and nicely covered in Horizon 2020, the running research and innovation program that is going to finish next year, 2020. As we were talking about this morning, a new program is seeing the light of the day, Horizon Europe, that will run from 2020 to 27. It's a very ambitious program, and certainly there will be several streams of funding where pain-focused and pain-related research will be able to put forward projects and ideas. I would like to congratulate certainly you for the amazing work you're doing and for all the knowledge you are producing that we are ready to listen to and to take on board certainly for the next work programs that will be produced. I invite you to look at the consultation that is running at the moment, and where you can add more of your considerations or your priorities, and that will be certainly taken in consideration. So thank you very much, and of course do not hesitate also to reach out to us, because we are in a listening mode always, and we are completely open to suggestions. Thank you very much.
Okay, and our final speaker on this panel is Professor Thomas Tuller, the Advocacy Committee Chair of EFIC and board member.
Thank you. So unlike usual, this time I come with a piece of paper to the lecture. This is from the External Relations Director, Vittoria. She said, 3 minutes, you will speak last. Well, I subdivided what we want to say from our point of view as European Pain Federation. The subtitle is The Future of Pain on the Political Agenda in Europe. And I have subdivided this into relations and dedications, research, education, future, and the platforms. So, first, relations and dedications. As a European Pain Federation, we are proud on all the achievements of our collaboration with we had with this societal impact of pain platform, and we want to continue on this. We have heard, and this will be in our agenda, that research will come and we will have options with the IMI, and we might also have options with Horizon Europe. And of course, we have heard also that digital medicine will be an important issue, and ICD-11 and ICF will be on our agenda to disseminate, and really strongly to help to disseminate it. And the next point then will be, I had the chance to speak about it myself this morning, to implement digital medicine into a better and broader treatment of patients. Then we will certainly continue on holding up the education. And we had the chance yesterday that our president-elect was able to speak on the MEP interest group, Brain, Mind and Pain, and noting that our work to advance multidisciplinary and interdisciplinary education is one of our major points. This we will need also your help to develop this. And then we have future, and the future which I have to draw in a short message today now is we will continue to do this part to ensure quality of pain care and seeking political support to advance this. And we have done this successfully together with SIP, in SIP, and as a part of it. And we will continue on this. And we also know and recognize that all what we discuss here on a European level has to be brought into our countries, because there we have then the reality of treating our patient in our country. And for this, we are very proud that there has been a development, and on the Valencia meeting, there has been the first meeting of 9 nations that have developed a national platform. And I'm very happy to go over the next week to Finland, and also to be part of the official start of the Finnish SIP platform. And there are others, and I would recommend Germany also has to think about it carefully. Why not at the end of the day also we provide something like a SIP platform? So, and my last words then, I had said that before, are very straightforward. On the last SIP meeting, I had said, well, let's go from great meetings to hard work. And I have seen all this. People have worked very hard, and we will continue in this and count on your help. Thank you. And this is a toolkit if you want to develop something in your country, and we will help you to do this.
Okay. I'll just start with a question from my side. We'll open up to the audience afterwards. Thomas, you said your slogan, I think it was the end of 2017, if I remember correctly, from great meetings to hard work. And I feel personally that that has been the case over the last 2 years. And I was really happy that we took this decision to go national, along with a few other things. What is the hard work from here in your eyes?
Yes, the hard work from here is that we really extend our platforms in our chapters. This will be a hard work, although there is substantial help to do this. And of course, I think after now a longer period of thinking about how the development might be, and now at the step where we have achieved so many things in order to present our ideas on a development of better treatment and political awareness, and now to change this into practical output. That we now, after we have prepared the ground, also with real big achievements that we could get by working together on the SIP platform, that we now have to define what will be the next step where we want to see why we did all this.
Thank you.
Do we have any
question from the audience? No, that's not the case.
Okay, I will jump in again. Monica, I don't know if you can answer about Commission issues more broadly. I know that DG Research is your background. But what does the new Commission mean for us working in health policy, and in particular on pain policies, and in particular the mandate of the new Health Commissioner?
I was stunned by the question, probably. This is a very difficult question, and I probably do not have the answer you would like to hear. But let's put it like this. The new commissioner who will take her post soon, hopefully, has made a very clear commitment to support research and reinforce the research European area. So I would say that the transition from the running commission that had a brilliant commissioner that made certainly a difference to this new commission is, I would say, it's a bright transition. We are hopeful that the agenda is very strong and research will be catered heavily. Of course, as my colleagues a few minutes ago were mentioning, it's a budget negotiation, that it's a very sticky point, and we hope that the member state will share this ambition of the Commission in putting forward this amazing program that is grown in scope and in ambition. I'm not sure I answered your question.
Maybe it was a little bit unfair of me, but I was hoping that you might be able to say something a little bit more about Stella Kyriakidis and the future of Commission from a health perspective.
Okay, that would be that would be DG Sante. It's too bad, actually. Is the colleague from Sante still here? She's gone, isn't she? Oops. Okay. Again, the Sante commissioner is certainly, again, she put forward a very strong statement. She's completely committed, and I would say she's just a very, let's say, because of the cancer mission and because of her personal commitment in this, I'm sure there will be a great output. So again, she's an amazing choice, and certainly she will deliver very strongly. And again, these are days where the DGs are starting to work together, and so we work very closely with Sante, and so we try to make things more and more and more coherent, which would be good news for everybody, I guess.
Thank you very much. All right.
Any more questions from the audience, maybe? If not, I've got plenty more. I'll go with them. Thomas, you've got a very strong organization in Germany. If only all of our EFIC chapters were as strong as the DGSS, I think we'd be in a very different position. I know some things are down to the size of the population, the resources available, but what are the success factors for what you do in Germany that could maybe be learnt by other EFIC chapters and other SIP national platforms?
Well, I don't know, but I believe that the infrastructure of an organization is very important. I mean, we have 3,500 individual members. They pay contributions to the society. That's very important. We raised their contribution fees, and so we put up a infrastructure in Berlin. We moved from the Rhine-Air to Berlin, and of course, you have a critical point where this then also results to work you can coordinate. We have really a lot of very, very, very motivated volunteering scientists in our chapter who work on all these special interest groups and all these proposals that we coordinate. And so I would invest in the infrastructure of the national chapters of the ISP to be able to have a indigenous growth there. It's good to spill Europe over with ZIP activities, but there's a lot of external finance within that process, I believe. And I think for a sustainable growth, it's important to strengthen the local entities of the ISP chapters.
Thank you. One last question.
One last question. We'll keep it quick. Deirdre, as the patient representative we have here today, tell us what is the view of Pain Alliance Europe, if you can speak for them, with regards to the future of SIP? Where would you like us to go that we haven't been before in the next 10 years?
I think it's probably more of the world that we want to see, if we imagine that as a place where the patient is believed, that the stigma has been reduced. I think we're really laying the foundation for that now. But that, like we've seen even in developments of mental health around stigma, that pain can go through a similar kind of journey. And really that all the research and all the hard work that's been put in now has been put into actual clinical practice. That we see not just from an academic point of view the changes that can be made, but that actually people are actually living that, and that patients are still at the core of the decision-making process, but also involved, as we've been talking about all day, from the very beginning. And that's also within hospital management, within research, within healthcare, within insurers, within all the stakeholders. Because the politicians understand that the people will go on the streets eventually if they're doing something so bad. But not everybody else has the same accountability in that same visible kind of way. We don't go outside our local GP and protest waiting to see them for so many weeks. But in a way, I think Pain Alliance Europe want to see that the work that's been put in now has created a future where that change has happened.
Thank you very much for all the answers.